Wonderful. Welcome, everyone. Welcome to our Global Health Tuesday seminar, Global Health in Action Alumni Career Panel. This is how we're going to spend our evening together. My name is Maria Moreno. I'm the GHI Associate for Experiential Education and your moderator for this evening's panel. Researchers and practitioners from the UW-Madison and across the world are invited to speak at GHI's Global Health Tuesdays seminar series. And this, I believe, is one of many we've had, which has been wonderful. The speakers showcase the complexity of global health challenges and the many kinds of expertise needed to address them. By sharing their experiences with the campus and Madison communities, these guests provide insights into global health, encourage conversation, and help connect colleagues locally and globally. Before we dive into tonight's seminar, I want to remind everyone that GHI is celebrating its 10th anniversary this year. There are many ways you can participate. Joining these webinars is one of them. We also invite you to sign up for our newsletters and please consider making a gift to GHI. You will find more information on our website at ghi.wisc.edu. Tonight, our panelists will share with how their global health education has impacted their lives and careers. We will have time for questions after the presentation. So put your questions in the chat and we will get back to them. Now I'd like to introduce tonight's panelists, and I won't go into much depth about their background since this is one of the things that they will talk about, but I will outline who will speak first. And first we will have Shehrose Charania, then Marjorie Kersten, followed by Theo, and finally Kayla Sippl. So please take it, Shehrose. Ross.
All right, can y'all see that? We're good? Okay, great. Hi, everyone. It's so great to be here. My name is Shehrose. I am a current graduate. I literally just graduated May 2021. So I'm one of the pandemic graduates. And so I'm very much in tune of how your year is also going. So I kind of just break down of kind of my background, how the Global Health Certificate really helped me narrow down into my future career and to where I am right now. I'll talk a little bit more about my field experience as well, and then where I am right now. But before that, I kind of want to talk about kind of my background. So why I'm really interested in global health. And so my parents actually immigrated from Karachi, Pakistan. They were born in 1961, 1969, and they actually moved to Chicago, Illinois, where I'm originally from, born and raised, actually Chicago, in 1991. And for me, a lot of the journey of what public health and global health specifically means to me is seeing my parents navigate, coming to this country and kind of navigating the cultural barriers that exist within the healthcare system. So I grew up kind of being the clinical navigator for my own mother in the hospital setting because she didn't speak English very well. So kind of seeing those first interactions really helped me, navigate like, okay, I want to definitely be in healthcare, but I didn't know what exactly. And that was kind of my first stepping stone into global health. That's a 2017 picture. I'm actually also a POST scholar, if you know what that is. It's a great scholarship that's on campus that I'm so thankful to receive and actually attend UW-Madison for. So this big question mark was my life because, like many of you, I think you see alumni and you're like, oh, they have their life figured out and whatnot. No one does. Like really honestly, no one does. And being really frank with you, I was really lost the 4 years. I was really exploring what I really wanted to do with my life. I was really interested. I make the joke that I think the national average of changing your major is like 4, but I was 5. So I beat the national average, kind of changed my major a lot. I went from being pre-med to pre-nursing, into nursing school, but I just knew for me, I was really more interested in the global health lens. And so a lot of the volunteer work and a lot of the activities that I did also stemmed from my personal own experiences. And I really wanted to explore that when I was in Madison. And so I ended up majoring in a new major on campus, which if you've heard of, it's health promotion, health equity. And I did certificates in global health and public policy, which I like to think of a undergraduate public health degree. And I hopefully UW-Madison has one day. But for me, it really helped me, narrow down that I really wanted to make change within the communities that I grew up in, specifically in immigrant and refugee households, because I wanted to, allow others to have the access to care that my family did not receive growing up. And so I really wanted to be that bridge. The really stepping stone for me in kind of narrowing down my goals in life, to put it lightly, was actually an elective course through the Global Health Certificate, which was social work 206, and it was Introduction to Social Policy. And this was actually spring 2020. So this is when the pandemic hit, which was so crazy because I was learning about the welfare system and learning about how poverty is, how the federal poverty line is and the evolution of it through the country, and kind of also talking about how with the pandemic, when we went online, kind of these concepts really made sense in my head because we were seeing in real time of how communities were disproportionately impacted, especially those who were low income, who were people of color, right? And seeing that in real action. And so for me, it was my bridge to the healthcare system, how I like to think of it. So this is kind of, I actually went on Canvas and kind of looked at the syllabus and kind of what was goal. And so I ended up just kind of taking it and like putting it here, which, it was developing an understanding of the causes and consequences of poverty, demographic scope, how poverty is distributed across groups, alternative explanations, as well as heightened awareness of the strengths and weaknesses of different policy responses to poverty. And I emphasize policy, which I will get to, but also another bridging aspect for me was where I did my field experience, which was at the Wisconsin Alliance for Women's Health, which for the Patch Youth, as a Patch Youth advocate intern, which Kayla is also going to talk more about. So I won't throw away her thunder or take away her thunder. And this was a really great project for me because I really was able to work with youth all across Wisconsin and learn more about kind of what does it mean to have rights in the healthcare setting as a young person, right? There's a lot of times when we're minors in the healthcare community, in the healthcare setting, where we don't know our rights when we go visit a doctor. And I didn't know either because, like I mentioned, my mother didn't speak English. So when I used to go to the provider, I never knew that I had rights and I had things that I was able to do or able to say because that was never communicated to my mother and myself, as English was not my first language either. And so for me, like this was a really powerful project for me because I was able to empower young people to take ownership of their health and take ownership of their life, because health is in everything, right? It's in all of our policies. It's who we are in everyday life. And so this was a really great project for me and a really great experience for me because it motivated me to take us. So that's a little picture of myself of this last year, where essentially I'm currently a student at the University of Minnesota and the Master of Public Health program in Public Health Administration. So with all of the things and a lot of the the opportunities that I explored, I just knew public health was somewhere that I belonged because I was able to really look at policy and look how can I use policy and innovation together to improve the quality of life of individuals in low income communities, like myself. And so for me, that was kind of the bridge for me. And currently I'm a student here, so definitely still get it's really interesting to be in a class, but also still learning about how we're living in a public health crisis right now and kind of seeing that in real action. With that being said, I feel like the Global Health Certificate really helped me narrow down my interests, and knowing that to be in healthcare, if that's where you want to see yourself, you don't have to just be a doctor or a nurse. There are other ways to be involved in healthcare to advance the quality of life of your patients and your community. And so for me, this certificate really helped me narrow that down and really helped me bridge that. And also I should mention, I'm a first generation college student as well. So for me, I came in really like bare blank, just trying to figure it out and trying to see where I belong. So I'm really happy that I'm currently a student right now. And I've just really enjoyed my time. And genuinely, if you have any questions, if you're thinking about going to grad school, I've literally went through it last year, which for me, I feel like I should have started thinking a little bit earlier on, but that's okay. You can still make it happen. It can still work out. If you have any questions, feel free to email me. You can also connect with me on LinkedIn if you need any help whatsoever through this crazy journey of undergraduate, and also if you want to navigate to grad school. So that's me. Sorry if I went over or if I talked too fast. But yeah,
that was
thanks.
wonderful, Shehrose. Thank you so much. Wow. Yeah. Well, we will share your contact information, and I'm sure some people will reach out. Yeah, this is wonderful to hear. Now we're moving on to Marjorie.
Hi, everyone. Well, my slides are pulled up. I'll just quickly introduce myself. So I'm Marjorie. I use she, her pronouns, and I graduated with a bachelor's in science in community and environmental sociology with the global health concentration in 2016. And I'm currently a Master of Public Health candidate at the University of Illinois at Chicago. So I wanted to start by sharing how the global health concentration at UW led me to where I am professionally. So I came to UW with intentions of becoming a veterinarian. That's what I wanted to do ever since I was a kid. So I was really interested in helping animals, and honestly hadn't really thought about human health at all. That wasn't something that was really of interest to me. And I stumbled upon the global health concentration and felt like that was something that was of interest to me because I loved different cultures. I loved to travel. So when I came to UW, my first 2 years, I was a biology major, pre-vet with the global health concentration. And I wasn't really thinking about how the global health concentration factored into that veterinary medicine. It was just kind of like, you know, aside almost from what I was pursuing with the veterinary medicine. And that all kind of changed by, year 2 into my undergrad degree, me taking the Health Impacts of Global Environmental Change course, which actually Jonathan Patz taught, and I know that he's on. So shout out to him for kind of opening my eyes to the ways in which environment affects health. And that was really formative to me because at that point in time in my life, I was super interested in sustainability. And so kind of making that connection, I see the thumbs up, making the connection between how environment affects health and kind of how that played into my interests was super important. It wasn't something that I had thought about before. And so I became really interested in how climate change and food systems affect health as a result. And I actually also through that class connected with Valerie Stull, who was not a doctor at the time, but is now a doctor, who went through the Environment and Resources PhD at UW. And at the time she was doing her dissertation work, and she was working on a project to study how edible insects could be used as an environmentally friendly and culturally appropriate way to address food insecurity in Zambia, which is in sub-Saharan Africa. So she presented during the class, and I was really interested in her work. It's super unique. I feel like I'd never heard about anything like that. And so immediately I wanted to kind of start working with her. So I started working with her. I actually was growing mealworms in Dr. Paskowitz's lab on campus. So that's how her and I connected. And I worked with her for a time as well on some of her research. But that all was kind of my introduction into the global health lens. And I'll kind of talk in a moment about how I actually got into the field to do some of that work. But at the same time that I was doing this research with Valerie and Dr. Paskowitz, I decided that biology was not the major for me anymore. So I also went through a couple of different major changes. So first, I thought I wanted to do agronomy so I could really become like a food systems person, but that was a little bit too like technical on the farm side for me. So I ended up in community and environmental sociology, which was a really incredible fit. And I feel like really kind of tied together my global health work with kind of the domestic work that seemed very naturally paired with what I was learning in the global health concentration. So after working with Valerie for about a year, Valerie and Dr. Paskowitz both encouraged me to apply for a Wisconsin IDEA undergraduate fellowship, something that I would have never applied to had I not gotten that nudge, just because as an undergrad, I was like, oh, I don't think I can do something like that. So I really appreciate their encouragement because I ended up being one of 6 projects selected to receive funding. I know that there's other WIF folks on this call too, so maybe they'll talk about their experiences. But my work with the Wisconsin IDEA Fellowship was an offshoot of Valerie's work. And I used qualitative methods to better understand consumer perceptions of edible insects to kind of provide her with more information for the project that she was doing. And I was able to travel to Zambia for a month between December 2015 and January 2016 to conduct research, which was really amazing. The first time I had ever been to the continent of Africa, the first time I had really done solo travel. So a lot of firsts in that trip, and just really, really foundational to what I wanted to do for the remainder of my life. I also received the 4W award for the work that I did, and that kind of just solidified to me how interdisciplinary global health work can be, and kind of set me on the course moving forward for what I wanted to do post-undergrad. Next slide, please. So after undergrad, I really wanted to get more global health experience, but I was torn about whether I wanted to work in sub-Saharan Africa, where I just had a global health experience, or in Latin America, where I was kind of setting myself up to work by studying Spanish language. And so ultimately I was just too torn and I couldn't make a decision. So I decided to do something domestically until I could figure out what I might want to do internationally. So I applied to several domestic food systems experiences, including AmeriCorps and Food Corps, and I ended up getting an AmeriCorps Vista position at the Greater Chicago Food Depository, which is the large food bank that serves Chicago and the suburbs. At the food depository, I coordinated free fresh produce distributions as part of a prescription produce program. And I actually worked in 17 community areas around Chicago in the south suburbs. So as someone who's white coming to Chicago, you don't usually go to parts of the city that are non-white. That's just kind of how it is, unfortunately, in Chicago. And so through this experience, I was able to really go to neighborhoods that I probably wouldn't have gone to before, see the health disparities that exist there, but also really connect with people who live and work in those communities and learn about what they're doing to address health disparities. So that really got me interested in community-based participatory research and working with communities to address the health disparities that they might face. And through these experiences at UW, I was also able to critically think about why health disparities were existing in these communities, and like kind of got the gears going about like what my role should be in addressing the disparities that I'm seeing. So after I finished my AmeriCorps year, I had a lot of short-term jobs. I kind of didn't know what I wanted to do. I was bouncing around a little bit. I recognized that there was a need to have someone who was an expert in food demonstrations to support initiatives like I'd worked on as a Vista member. So I had a few culinary arts jobs where I was doing cooking demonstrations in nutrition and cooking education, and then wanted something more permanent. So I landed as a curriculum and quality specialist at the YMCA of Metro Chicago. And I led curriculum design and co-led evaluation for the suite of healthy living curriculum at the YMCA. And in this position, I was really challenged to kind of think about how to work with limited resources and lack of sustainability. So for folks who have worked in nonprofit or are thinking about it, the realities are that you're often on grant cycles that make it sometimes challenging to have programs run continuously. And so I think, you know, that applies to a lot of situations outside of nonprofits in the US and was a really important learning experience for me. Next slide, please. So looking for a way to have more sustainable impact, I decided to kind of make my way back to academia. So right now I'm pursuing a master's in public health at the University of Illinois at Chicago, and I'm in the Division of Community Health Sciences with a concentration in global health. So there isn't like a specific global health division at UIC, but there is a concentration, which is great. And so far during my MPH, I've been really able to build upon what I learned while completing my undergraduate degree. And really the most important thing that I've built on is really thinking about how to work with communities, like with being the key word. So not coming in and doing things for them, but alongside them, and doing so both domestically and globally. So one component of my program is that there is an applied practice experience, which is kind of like an internship. So ideally, I would have done that somewhere globally, but because of the pandemic, that wasn't possible. So I did a domestic global health experience where I worked in a predominantly Latinx community in Chicago and helped a food pantry better understand how to provide nutrition education for that community by creating a toolkit of resources for them to use. So that was really informative. And one thing that I'll add just as an aside that I really appreciate about Chicago is how diverse it is. So even if you want to do global health work, but you can't travel, there's still ways to do that within Chicago, which was a big learning experience for me. That wasn't always how I had conceptualized global health. And then I also have a couple of research positions at UIC. So one position is with the Shehrose Lab, and I'm using community-based participatory research to understand community perceptions of food insecurity. And then with the Nutrition Equity and Justice Partners, I'm leading a breastfeeding equity learning collaborative, and I'm also supporting evaluation for the AHEAD and WIC project. Next slide, please. So I wanted to share a bit about what I'm thinking for my future as I'm going to be wrapping up my MPH program this coming spring. So I'm currently applying to PhD programs. The applications are actually due tomorrow. So I'm a little bit frenzied right now with working on that. Wish me luck on that. And that desire is just to kind of build my skill set so that I can most effectively work in global health alongside populations. I feel like there's still a lot that I can learn. I'm also really interested in working with immigrant and refugee populations in the US as kind of a domestic global health model. And then really just looking for more ways to get involved in both academia and community settings. I think with the pandemic, it's a little bit challenging to get some of that global health experience. So I'm hoping that through a PhD program, I can get some more of that hands-on experience. Next slide, please. And then I just want to wrap with some lessons learned. I think maybe some of this will come up if folks have questions, but I'll go through this pretty quickly. So I think some things that I've learned through the global health concentration as well as my professional experiences afterwards are that global health is a really diverse field. And that topics are all really interconnected within the global health space. So I think, I call myself a food systems person now because that's what I've been doing for a while. But I've also been able to weave in working on COVID-19 as well as breastfeeding equity, and all of those things are interconnected. So I think that's really important to consider. Like I mentioned before, for the longest time, I thought that global health work meant that you need to travel the world to do your work, but I'm realizing that it can be done domestically as well, depending on where you live. For me, hands-on experiences proved to be more foundational than classroom experiences. I did mention that, that one course really kind of sparked and moved me in this direction. But aside from that, those hands-on experiences have been really, really foundational. And then I can't say it enough, but networking is really, really important. And I know for some people that's like a little bit uncomfortable, but I've really gotten most of the opportunities that I've had through conducting informational interviews with people. So just reaching out and saying, hey, I'm really interested in your work, and not asking for something right away. And then, you can connect with someone and they'll keep you in mind for an opportunity, or you'll hear something from them. So those are the kind of things that I've taken with me and will continue to take with me as I move on to other opportunities professionally. And I'll end there. Thank you so much.
Mm-hmm. Thank you, Marjorie. That was wonderful. All right. So moving right along, we have we have Theo. Yes.
Hey guys, my name's Theo. I don't have any slides, so I'm just going to talk with you. So I'm a UW alum, class of 2016. And while I'm still very much figuring out my own career, I think I'm here with you to share the path that I took to get at least to where I am now. So I was lucky to spend an amazing 4 years at UW studying microbiology and global health. And reflecting back on my time here at UW, I found it so influential because of the peers and the mentors that helped me to really take what I learned in class and apply it to the real world. And this is even more so true for the Global Health Certificate Program staff and students. They asked me some really, really hard questions. They connected me with other minds to refine my ideas. And they directed me to funding opportunities as well as other resources to bring my work to life. So some of the projects I'm really proud of include helping find a new bacteria that causes Lyme disease. I worked with Susan Paskowitz and Mayo Clinic on that. I conducted a health impact assessment on waterborne disease transmission in rural South Africa. And I received the Clinton Foundation Innovation Award for developing a HIV diagnostic field test. So these wins could not have been possible without the guidance, without the advice, and without the resources available to me through UW, and even more so having joined the Global Health Certificate Program. So these kinds of resources after graduation are not so readily available, if available at all. So my key advice here is to take advantage of them while they're at your fingertips. So apply for that grant, pick your professor's brains, collaborate with your peers, and talk to your advisors. So after graduation, I used those mentioned wins to continue my studies at the University of California, Berkeley School of Public Health. And while I was there, I was mentored by Nobel laureate Kirk Smith and worked in a research lab that worked with infectious diseases and quantitative modeling. I also developed and taught a 3-course series on spatial analysis and data science for public health. And to cap off my program, I was nominated to attend the United Nations Conference on Climate Change and was tasked to communicate adverse infectious disease epidemiology data to use as a driver for green policies. So after all of my academic training, I went on to go to work on as a research manager for a Silicon Valley startup. And we developed clinical studies and softwares for large pharmaceutical companies. So at the time, I was working with GSK and ViiV on some of their novel drugs that they just pushed to phase 3 and 4. And while being in the Bay Area, I was surrounded by a lot of big doers and a lot of big ideas. And so that was really an inspiration for me to really take an idea and make it into something tangible. So I was fortunate enough to come up with an idea for a urological medical device. And so later that year, I founded a small company to manufacture and distribute that. So a year from that, I moved from the Bay Area to San Diego to be the county's lead epidemiologist for schools. And so while I was at the county, I wrote programs and softwares to automate their contact tracing system, as well as predicted outbreaks for public health interventions within K-12 facilities. And since then, I'm currently working for a remote company based in Silicon Valley. We're called Brightline, and we're a pediatric mental health startup. And so I'm the data scientist there leading their clinical analytics. We just received $72 million in Series B funding, and we're going to be using that to expand our mental health services to all 50 states in 2022. So I'm still very early on in my career, and I'm still making a ton of mistakes and figuring out a lot of things as well. But in my whirlwind years after graduating, I think there are 3 pieces of advice that I keep on reminding myself, which may help you guys in your own careers. The first is it's a reminder that intelligence is not the ability to recall and understand concepts. Equally important is the ability to appropriately apply relevant information to a problem. So the Global Health Certificate field experience really helped me develop this part of my brain, and it really was a welcome break from the monotony of testing in my education. So if you can demonstrate your ability to identify problems, use the appropriate tools and subject matter expertise to solve them, and be able to articulate these wins in your resume, I guarantee there will be a line of people out the door ready to hire you. My second piece of advice is to make learning an enjoyable habit. And I know it's really easy to have PTSD from all of the late night exam preparation, but because you graduate and you're out of school doesn't mean that you should stop learning. Health professions are not only wide in breadth, but they're also growing. So my advice would be to be honest with what aspects of the work that you like and that you love, and to go above and beyond to consume relevant content through whatever media works for you. So for me, that's podcasts, that's books, research papers, and more recently, it's been more casual channels of information. So that includes Facebook groups, as well as YouTube channels and Reddits. So, be an expert in this field, be an expert in what you enjoy and love, and apply that in your work. And finally, and most important piece of advice, at least for myself, is take the time to live. Put your work down to cook a homemade meal for your loved ones, and push back on end of day meetings to exercise. Work with your managers to block off a couple of weeks throughout the year for you to travel, to pursue your hobbies, to sleep. It doesn't really matter. Do whatever you want to do, and just make time to do the things that fuel your happiness in life. Your job shouldn't dictate the activities of your personal life, and at a minimum, it should be an activity that enables you to pursue the life that you want. Ideally, it's an activity that also adds to the fulfillment of your life. So if possible, find aspects of your career that bring you joy and fulfillment. I'm incredibly lucky because I love the challenge of learning new data tools, improving care by generating insights through algorithms, and all the crazy drama that comes with building a business, all of which constitute a large part of my job. So kudos to those of you who can find enjoyment and fulfillment in aspects of your career. And if you don't have that right now, that's completely okay. Make sure to take care of yourself so you can put your best foot forward, firstly for yourself, and secondly for all of the other commitments that you have in your life. I think you'll be surprised with how naturally things fall into place when you make yourself a priority. So best of luck to everyone on finding and developing your careers. I hope that this general advice has been helpful, and I'm more than happy to discuss more pointed industry-related topics for those of you who are looking to pursue epidemiology, health tech, or startups. So I'll drop my LinkedIn and email in the chat below, and feel free to hit me up. Thank you, guys.
Thank you, Theo. Thank you for those words of advice. So far, you guys are rocking. Thank you. And now finally, we have Kayla.
All right. Apologies in advance. I think my Wi-Fi is tired today, so it's going in and out. So just for those of you that have your camera on, wave at me if I suddenly start cutting out. My name is Kayla Sippl. My pronouns are she, her, hers, and I graduated in 2015. And to be honest, my journey since then professionally has been fairly winding. I think that was one of the biggest takeaways coming out of university. It was just that it doesn't have to be a direct path that makes sense that would make sense. It's been all over the place and unexpected, and I've really enjoyed how I've been able to explore different topics and feel grateful for where I am. So I hope by sharing this can be helpful for some of you. And like everyone else mentioned, feel free to reach out after we all end up speaking, or after this gets done with any questions. So I would say there were two main experiences during my time at UW that really impacted me. The first, well, actually, let me back up. So when I went into UW, I had no idea what global health was or public health. I knew I enjoyed health, and I thought that meant I was going to be a pediatrician. And so I lined myself up to go to medical school. I did end up graduating with a degree in biology. But as I started talking to more pediatricians, I heard them saying that they were frustrated with systemic problems and that they weren't able to address them, or that they had actually gone and gotten a degree in public health before they felt like they could make the change that they wanted to. And that really stuck with me. And so I started exploring what UW at that time had as far as global health or public health, and came across the Global Health Certificate. And I really fell in love with, to be honest, I don't remember the specific classes, but I just remember learning about how like root causes were being discussed, and systemic barriers, and all of these different things that just looked at health so broadly. I knew that was what I was still decided to study biology, but knew I wanted to do Global Health Certificate as well. I think my field experience was my study abroad semester. However, I'm pretty sure I decided to study abroad before I realized it would count. So it was just an added bonus. But I studied abroad as a sophomore in Kenya, and it was there that I fell in love with traveling. Kind of like Marjorie had mentioned, it was the first time I had left the country by myself, and really loved just like meeting people, trying new foods, learning about cultures. And while I was there, I also talked with different people and organizations, and that ended up leading to doing a partnership project. Through the Wisconsin Idea Fellowship, I was able to return to Kenya and work on a soap making project. And then through the Clinton Global University Initiative, CGIU, I was able to go back again after I graduated. However, to be honest, one of the biggest things that has stuck with me was my global health advisor at the time was Robin. And I remember Robin was the first one who introduced me to the white savior complex and really helped me sit and think critically about how I was potentially perpetuating that with the soap project I was doing, and how I needed to really make sure that I was partnering with the right people and making sure voices were being heard, and I was centering those voices. So after that, I ended up working with Dr. Paskowitz in her entomology lab. And originally I had just been studying mosquitoes and ticks. And then when I decided I was interested in public health, I worked with the State Department of Health on a project that asked veterinary clinics throughout the state of Wisconsin to send in tick samples. And then we would test the ticks in Dr. Paskowitz's lab, and then take all the data and give it back out to the public at the State Department. And when I graduated, it was because of working at the State Department that my boss at the time had told me, they're hiring a recent grad at a different department. You should take a look at it. And so I did, and that landed me in the field of mental health. At the time, if you would have asked me if I was going to go into mental health, I probably would have told you no. However, it just so worked out. And I remember at that time too, that a couple of my family members were really struggling with mental health. And I wanted to find ways to help better support them, and knew that I needed to take a look at my own mental health and really work on supporting myself as well. So I started right after graduating as the youth coordinator for the Youth Empowerment Solutions Grant. It was trying to look at how the mental health system in Wisconsin could better support youth and young adults. And they had decided that they wanted to have a young person at the state and then at the county levels to make sure that youth voice was being centered in that work. In theory, it was good. In practice, it could have been better, but we learned a lot. And so I would say that from the Global Health Certificate, what I applied to that job was really thinking about whose voices we were hearing and listening to, and whose voices were missing, or even just who to talk to learn whose voices were missing. And another thing that I had taken away was thinking about who's already doing similar work and learning and making partnerships to learn what they're doing, what they think needs to be addressed, and then trying to fill those gaps instead of potentially recreating the wheel. So after I worked there for a couple of years, and then after that, presidents were changing, and the grant that I was under was up in the air. And so, oh, sorry, I got distracted by the chat. So anyway, at that time, I decided to leave and ended up traveling for a month in Central America with a friend of mine. And then decided at that point that I knew I wanted to take a break from working and travel some more. But I just first came back to Madison and knew that I wanted to make a little bit more money for doing that. And so I sat down and thought about what I wanted to learn more about. And I decided that even though I had grown up with a garden and my parents asking me to help them grow food, I never really took an interest in learning how to grow food. And so that landed me that interest in wanting to learn more about food production, and landed me at an internship with the Goodman Youth Farm in Madison, where I was able to do environmental education with young kids to teenagers, and had the challenge of making things like weeding and mulching fun, which I really enjoyed, and I hope they did too, but I think it might have been, it was fun. So yeah, after I did that for a little while, I ended up leaving. I traveled in Southeast Asia for about 9 months by myself. And during that time, really was just meeting people and talking with people and trying to learn as much as I could and hear their perspective as far as how life was and things that I had heard in the media, the news about certain places, and asking when appropriate, asking their perspective on how they felt about that. When I came back to the States, I had been helping a friend move and mentioned to her family members that I was looking for a job. And that's how I ended up applying for becoming an advocate at a domestic violence shelter. And I mentioned that because I think also in my head, while I was in university, I think I had thought that it's very much like you search the job and then you apply for the job, and it's this like linear path versus like, nope, I literally just said I'm looking for a job to a friend, family member, and they were like, oh, you should check out this like place, they're hiring. So sometimes those opportunities can come really unexpectedly. But at the domestic violence shelter, I really enjoyed learning more about women's health and just different things that I had not learned before about like the cycle of violence and how to work with a crisis line and answer crisis phones. Yeah, and then after I got done there, I knew that I wanted to come to Costa Rica, which is where I currently am. However, I came here simply because my partner was here and I wanted to not have a long distance relationship. And so, but when I came here, I had no idea what I was going to do. And so I took the advice of people from the Global Health Certificate and looked to see what nonprofits were doing what, and just started reaching out. I think like the others had mentioned, just asking like, can I talk to you about your journey and what you've learned and what you're doing now? And sometimes that leads to different opportunities and sometimes it doesn't. But for example, I was able to talk to somebody who runs a responsible travel agency and wrote a guest blog post for them about Costa Rican travel agencies working to really have sustainable tourism programs and projects. So yeah, that was that. And then I ended up, fun fact, Costa Rica doesn't have an army. And so the United Nations decided to establish a university for peace here. And it just so happens to be located 20 minutes from where my partner lives. And so at that point, I'd also reached out to them and said, hey, what are you doing? Can I volunteer? And they were like, well, with the pandemic, we need to run our next conference virtually. Do you want to intern and help us figure out what that will look like? And from there, it's led to some other fun partnerships. And the last thing, like Shehrose had alluded to earlier on, was that most recently, I reconnected with somebody, a partner who I originally had when I first graduated, when I was a youth coordinator. And through reaching out to this person, they are now my boss, and I work with the Wisconsin Alliance for Women's Health as the youth coordinator for a social emotional health fellowship, where we have a group of young adults who are hired to be youth advocates and learn about advocacy in their communities and complete projects to improve adolescent health in Wisconsin. So after all of that, thank you for following along on the wild journey. But I would just kind of repeat what other people have said, and that connections are everything. Somebody once gave me really good advice that I've started but yet to continue, is that if you're a spreadsheet person, keep a spreadsheet of all the contacts that you have, or really important contacts, and just keep track of when you've reached out to them and anything they might have mentioned that's important going on in their lives. I would love to go back to grad school someday and know that I'm going to need letters of recommendation, and sometimes it's been a long time since I've kept in contact, and so that can be really helpful. Another thing is reaching out and asking questions to anyone and everyone. I think that can lead to really interesting experiences or opportunities, job opportunities included. And if possible, to volunteer. I completely understand volunteering is a privilege and you need resources to be able to do that. So if you can, it can be a great way, whether it's something small like writing a guest blog post, or a larger commitment. It can be a good way to meet more people. And lastly, like Theo said, to take care of yourself. I think that was something that I was completely missing for a long period, and I'm still learning how to do it well, but it can be really important, especially in the field of global health. Thank you.
Wonderful. Thank you, Kayla. Thank you, Shehrose, Marjorie, Theo. Oh, it's really inspiring. Please put your questions in the chat, and I will follow up with our speakers. Yeah, I love that. Well, we call it wellness emphasis, Theo and Kayla. It's really, really important. Any questions for our speakers? Okay, we have Lori here. What are the important things that we should be teaching now? And anyone can take that? Yes, go ahead, Marjorie.
Yeah, I think what Kayla talked about is really important. I think the white savior complex, and talking about, although I didn't name that specifically, that's kind of what I was alluding to, and kind of what I'm still wrestling with in a lot of my work, is how, given my identity, I can have an impact in kind of all of the things that we've talked about without being someone who's steamrolling. That's not the technical term to call it, but coming in and making decisions for communities, thinking that you know best. And so I think as much as we can call attention to that is something that I think is really important. And I know so many people who came out of undergrad and did Peace Corps or did AmeriCorps like myself, and did a study abroad or some sort of research experience during their undergrad, and unintentionally were white saviors and didn't really have the knowledge or the language to talk about it until afterward. And I think a lot of potential harm could be mitigated by talking about that from the beginning and making sure that people understand, what their role should be as global health practitioners and just people in the world as well.
Thank you, Marjorie. Anyone else from the panel would like to answer that question?
jump in and say something quick. I think a lot of, granted, I will preface this with, I thought I was going into grad school after, and so I greatly ignored a lot of like the resume help and that kind of thing until after I was like, oh no, I actually do want to go into the workforce. But for me, things that I wish I would have either taken advantage of or potentially could have been taught are skills like networking and how to keep those contacts alive, because sometimes it, like Marjorie had said, it can feel really uncomfortable just reaching out to somebody and be like, this is what's going on in my life, or, you know, how do you start that conversation or keep that going? Or even like emails and how to send, you know, or how to deal with conflict. Conflict resolution is a big one for me personally that I really want to work on. Yeah, those are just some thoughts.
Thank you. Yeah, that network is very important. And I just like to emphasize that all 4 panelists responded to my email very quickly. So thank you. Really appreciate that. All right, moving right along. Paul, well, hold on. I think there was someone else before. Oh, I think I missed it. Paul, thank you for your presentation. For those of you who are planning to or are in or have graduate or have graduated from graduate public health programs, what criteria do you use to evaluate your prospective programs?
Yeah, that's a really good question. I think many times you think that you want to look at, you know, the rank of the school, or like you want to look at, oh, this is how many acceptance rates, whatnot, which is all great if that's what you're looking for. What I really looked into was genuinely like the people of the program and the program directors. Literally, when I was applying, what I would do is I would email the director of the programs. So for example, I'm at Minnesota, and so I would literally email director of the program like, hey, like, can I set up like an information interview with you? I just wanted to learn more about the program, learn more about kind of like what the community is like, what the cohort is like, and what kind of the people are like. And that for me, kind of when I talked to the program director, I felt so included and so welcomed. And like for me, that set that school apart versus when I would apply to another school, which I won't mention right now. But when I was doing like that informational interview with them, it felt very, how do I explain it? Like very pretentious. It felt like I should have been thankful that I got accepted. And like, you know, it's like, I felt more like a checkbox for them versus like here, not that I'm selling Minnesota to you all, but I'm just saying like in my experience, like that's kind of what mattered to me. So definitely you can look at, you know, grades, you can look at stats and all of that, which other people can touch on. For me, it really mattered the vibe of the school and kind of more about that interconnectedness feeling that I so wanted, especially as someone who's coming straight out of undergrad and grad. I kind of still wanted, you know, a community aspect of it. So that's what kind of mattered to me.
Yes, Shehrose. Go ahead, Theo.
Just to tag on to that, for those of you who are going into research, I would recommend looking at the research page for that university and that department, looking at the lab's recent publications, perusing all the grant databases, NSF, just to see if they have funding for a new hire or a researcher position for their lab, and just understanding if your interests align with the research interests at that university. And then I'd tag along, you know, then you can go into Shehrose's advice as well to just coffee chat them and see if you have like a alignment in values and personality.
Mm-hmm. Yeah, great point. Just going back, there was another question by Sippl. What is something you wish you had done as an undergrad that would have set you up better in the career that you are currently in?
I knew the job perspectives for the program that I was getting into. I would have talked with the advisors and just figure out what the job attained after graduation is and what those jobs are and what the hard skills needed are to get those jobs.
Okay, thank you. What are some, Max, what are some practical differences between public health PhD and global health PhD? And he has an interest in African studies, but is currently doing work on COVID, which is more local.
I can try to answer this because I've been looking into that a little bit as I'm applying to programs. Personally, so one of my main considerations for PhD programs is I am place-based right now. I want to stay in Chicago for a number of reasons. And so for me, that was a really big factor. But also in my search, there really aren't a ton, at least that I found, global health PhD programs. And so, there's a couple on the West Coast in Washington. There's Hopkins has an international health program, but they only accept 4 people per year. So that's an important consideration. And so I think through having a lot of informational interviews with folks, what I've learned is that, and through my personal experience, like you can do global health work while still being in the US. You can also do global health work by networking with faculty that's, in a different division, school, whatever it might be at a university, who's working in the place that you want to work, and try to add something onto their project. So I think it depends on what you're looking for. I think it's a similar question to what was asked about how folks consider MPH programs and like how you make decisions about that. I think there are a lot of considerations, funding, where you want to be place-wise, what specifically you want to do topically within the space of global health. So I think there are a lot of considerations, and I'll leave it there. Anyone want to add on to that?
Okay, thank you. A question by Campbell is, apart from networking, which has been emphasized repeatedly this evening, what are some other examples or resources that you would recommend for obtaining more exposure as an undergraduate student?
I think if you have an idea for anything, whether it's a program, whether it's community-based, whether it's research, I think UW, from my experience, has been unique because they have a variety of different grants at all different, levels of prestige. Some are a couple grand, some of them are much larger, and they have the support and the resources to help you develop that application to get your idea through. So I think, that's one of the things that really launched my career, was taking advantage of that resource.
Great.
Yeah, and I just also wanted to add, I think this also goes back to Shabonet's question, which had to do with something that I wish I knew in undergrad too. I think it's so important. I think you might get more of it, but LinkedIn is actually really great. Like, I know like people are scared of LinkedIn because of like the stigma that's around it, like it's just kind of like a bragging portal, but it's really not if you navigate like the right way. Like, I can tell you, literally LinkedIn has become my best friend this first semester of grad school. Literally, of every opportunity that I've wanted, everyone that I've ever talked to, I literally just go on LinkedIn, I ask to connect, and I write a little personalized message like, hey, like I'm really interested in this, can I please talk to you? And literally everyone who's on LinkedIn wants to talk to people because that's why they're on LinkedIn. So like what I would recommend is, like, honestly, like in undergrad, I always thought like I'm too young to be on LinkedIn. I was like, it's not for me, right? But honestly, it's never too early to start. Like, I definitely recommend going on it, explore, like make your nice headshot, nice profile picture, like, make your experiences on there, because people really do use it and actually seek out potential employees through that too. So definitely a really great resource to navigate and use. And if you need help like navigating your LinkedIn page and like how to create little like lines and whatnot, I literally spent all semester kind of figuring it out and kind of making sure that it's great. So it definitely can help you there too if you want it.
I'll jump in here too and say that I now follow people who like list specifically global health job openings. Some are pretty high international levels, but yeah, just there's lots of people who now have that platform and are using it to list job opportunities, which is great. And I think it can be a good way to connect with people who you haven't met, especially during COVID. It could be a good way to network.
Yeah, those are all great advice. Thank you. And of course, events like this one is another great example that we're offering students. We did have also a Peace Corps one a few months ago. So that's kind of showcasing what's out there that students could start thinking of. So, and it's never too late to get ready. Anyone else? We're coming down to the wire. Thank you, Campbell.
I'll just say too, one thing that I've learned is that even though I didn't necessarily take advantage of some of these opportunities that like for resume building or that kind of thing while I was in UW, I found different ways to do that after graduating. Like, for example, one thing I wish I would have taken advantage of during undergrad was learning how to write a grant and practicing that skill with people who are amazing at doing it. But I didn't know what I was going to do. But now in the current job, I told my boss, like, this is something I really want to do. And they were able to find additional funding to help give me hours. So I just, am practicing that now in the job, which if you're flexible, bosses can be a great way to do that too.
Mhm. It's wonderful. Any last questions? We have just a few more minutes. I think once again, I can't thank Marjorie, Kayla, Theo, and Shehrose enough. As I said, all of you responded very quickly, so that's wonderful. But more importantly, that you're willing to talk about your experience, that trajectory, because we do have a number of students on board who are listening and are taking notes and will follow some of the suggestions and advice that you have provided. So this is wonderful. And this is an effort in many ways to try to offer the students kind of a way to start thinking about what they need, listening to fellow graduates, alumni, that it's not too far into the past, just to kind of talk about what you've done and how you've done it and some of the path that you've taken and the opportunities that you've sought. So that's, it's always wonderful to see that. And it's wonderful to hear. So Jonathan, I'm not sure if you want to say anything else. We're wrapping it up here. Or Susan, if you're available.
No, it's really valuable to hear from these graduates who've gone out there and are doing great things. And of course, they're smarter than this older generation too, smarter and more innovative. So thank you for the great ideas and for participating.
Yeah. And thank you to those of you who are in attendance. Thank you for joining us this evening. It's wonderful. It's wonderful to see the interest and the commitment.
Maria, thank you for putting everything together. This was great.
No, thank you.